recorded video. And with that, I would like to then transition over to introducing Dr. Kilmarx himself, who is a returned Peace Corps volunteer. Dr. Kilmarx is an expert in infectious diseases. He served since 2015 as the Deputy Director of the Fogarty International Center at the National Institutes of Health. He's had leadership positions at CDC that include serving as the country director in Zimbabwe and Botswana, and as the epidemiology branch chief at the Division of HIV/AIDS Prevention. He has helped lead Ebola response efforts in Sierra Leone, Guinea, and the DRC. He earned his MD from Dartmouth Brown's combined program in medicine, and he completed internal medicine residency and infectious disease fellowship at Johns Hopkins University. He has served 23 years in the public health service, rising to the rank of Rear Admiral. And Dr. Kilmarx began his international career as a Peace Corps volunteer in the DRC, which at the time was known as Zaire, where he was a fish head. He helped develop fisheries that are still productive today. So Dr. Kilmarx, Peter, I'm very just grateful to have you with us today. Thank you so much for helping arrange for Dr. Fauci to speak to us and to the broader Peace Corps community today and all who are engaged in the COVID response. Would like to pass the word to you, Dr. Kilmarx, for your remarks. Thank you so much.
Well, thank you, Glenn, for the kind introduction. And also thank you for your tireless work on behalf of all of us as returned Peace Corps volunteers and for your work promoting the vision and the mission of the Peace Corps. Hi, everybody. Good afternoon. Today is really an exciting milestone for the National Peace Corps Association in their efforts to engage you, to engage our PCVs in the COVID-19 response. And it should be an exciting day for you, those of you joining this historic global effort to control the pandemic. So contact tracing, as Dr. Fauci mentioned, it's really a time-honored, proven effective strategy for controlling and even eradicating infectious diseases that are transmitted from person to person. These include ancient scourges like syphilis, smallpox, and tuberculosis, and also newer emerging infections such as Ebola, SARS, and now COVID-19. The premise is really simple and straightforward. Just identify people who are exposed to an infection and have them treated or quarantined so they won't transmit the pathogen to others if and when they become infectious. And when it's done right, contact tracing is really very effective. In New Zealand, contact tracers brought the average time from the onset of illness to isolation from 7.2 days in March down to negative 2.7 days in April. So that means on average, the cases were isolated 2.7 days before they fell ill, and local transmission in New Zealand dropped to 0. Glenn asked me to talk about what makes a great contact tracer. And it's been said that contact tracers are part detective, part therapist, and part social worker. And I think that's exactly right. You need to be able to piece together how someone was infected and to whom they might have transmitted the virus. But first you need to connect with them as a human being and meet them where they are and address their needs, which includes listening and responding to them. They can have anxiety, fear, and even anger. And then in many cases, this will extend to connecting them with medical care, to food, and to shelter if they need to be isolated or quarantined. And historically in the United States, there were tens of thousands of public health staff who could conduct contact tracing. But following the economic crisis of 2008, those numbers were reduced to only a total of a couple of thousand nationwide. And this is, of course, woefully inadequate for the COVID-19 outbreak. Most estimates are that we need at least 100,000 contact tracers to address COVID-19. We're up to more than 53,000 in the most recent national survey, but we still have a long way to go. So you're really helping fill a national need. In the meantime, you as contact tracers have a vital role in stopping transmission, in meeting the needs of the communities that are at greatest risk. And ultimately, you'll be part of the end game. That's when every new case is a known contact already in quarantine, and together with vaccination, COVID-19 will be controlled in the United States. But following that, there's already calls for a large permanent public health workforce in this country, and you can join that to help address the chronic health inequities that have been uncovered by COVID-19. So as has been mentioned 7 months ago, back in March, when 7,300 Peace Corps volunteers were being evacuated worldwide, some of you, they were coming home to a massive public health crisis coupled with a massive unemployment crisis. I emailed Dr. Jeff Duchin, who's the King County Public Health Officer and an old friend and colleague, and asked him if returned Peace Corps volunteers would be helpful to him for contact tracing in King County. He was up to his ears in the middle of what was at the time the biggest COVID-19 outbreak in the country, but his two-word response came almost immediately. He said, hell yes. So the next day, as Glenn mentioned, on March 22nd, we were on the phone with Jeff and Glenn and other national public health experts about standing up what we called a COVID-19 response corps with returned Peace Corps volunteers as vetted and a resilient workforce trained and motivated for community service and culturally competent. Since then, I'm really thrilled to see that hundreds of RPCVs have joined in the COVID-19 response with CDC and FEMA and other federal and state and local entities. So I want to thank Glenn and John and the National Peace Corps Association and Jeff and King County Public Health, and really all of you, again, as Dr. Fauci said, for stepping up to confront this once in a century historic global health challenge. So if you ask me what makes a great contact tracer, I would say a returned Peace Corps volunteer, or really anyone that has that kind of resilience, cultural competence, and a spirit of service for the community. We're really in the middle of a historic struggle that goes beyond the immediate health threat. This is an ultra marathon. Stay safe, masks on, take care of yourselves, and take care of each other physically and mentally. Thank you, everyone, and my very best wishes to each and every one of you.
Thank you very much, Peter. And again, thank you so much for being with us today out of your busy schedule as well. Thank you for helping arrange for Dr. Fauci to share those remarks with us, and really just for providing the vision since early March to this concept of returned Peace Corps volunteers and the COVID response corps. It's really come to fruition in many ways. As you said, RPCVs working around the country, across the country, and COVID response in a variety of different organizations and entities. And we're just very happy to have many of them here with us working together with King County. I think at this point, I'm not sure what's next in the agenda, but I believe